Hi, my name's Renee. I'm hygienist at Provident Dentistry at Canton Park. We recently asked our patients to write in with some common questions that they might have, and we decided to start a forum. Today we're going to be talking about the dental hygiene related questions. So let's begin. A question we received was, why do I need a dental cleaning every 6 months? So the answer to that is everybody forms plaque. We know that. Even if you have the best dental hygiene, that plaque is going to find a place to stick to your teeth. It could be around your crowns, your fillings, onto root surfaces, and even the person with the best oral hygiene is going to have some of that plaque turn into tartar. So what happens with that process is you form the plaque. If it's not completely removed, and again, even the best brusher and flosser is going to leave some behind, that plaque starts to mineralize from minerals in your saliva and it turns into tartar. That tartar causes inflammation and bone loss if it's not removed. So that's why it's important, even though you have good oral hygiene and nice teeth, it's important to come every 6 months at least. Now, if you are showing signs of gum disease, your hygienist may recommend a deeper cleaning. And usually we recommend that when we see bone loss. So when you come in about once a year, your hygienist does what we call a periodontal chart, where we're measuring the pockets between the tooth and the gum. We should only be able to put our instrument in about 3 millimeters. When we start seeing 4s, 5s, and 6s, that means that you're getting some bone loss. And we will need to do a deeper cleaning to go down into those pockets and get that tartar out and help stop the disease. We want to avoid things like future bone loss, inflamed gums, and gum recession. Why do I need to come every 3 to 4 months for cleanings? So when you have a history of gum disease, you have that bone loss like we talked about. You're going to get plaque and bacteria down in those pockets where the bone loss is. Studies show that it takes about 3 to 4 months for that bacteria to start causing more bone loss. So that's the rationale behind coming every 3 to 4 months. We remove it for you before it has a chance to cause more bone loss and more inflammation. Why do my teeth feel loose? That's a good question. So if you have a more severe case of gum disease, your teeth feel loose because you've lost quite a bit of bone. And again, that's caused from the plaque and the bacteria causing inflammation and eating away at the bone. In our office, we can treat gum disease, but if it's very severe, very high pockets, we will consider sending you to a periodontist where they have some different procedures that they can do, such as surgeries. So what are some signs of a healthy mouth? Your mouth should have firm pink gums that haven't receded and sit at their place on the tooth that they're supposed to, gums that don't bleed when brushed or flossed. This is a big one. It's common for bleeding gums, but it's not healthy. And there really shouldn't be any visible buildup. If you have a lot of plaque and tartar, it's time to get a cleaning. So what are some tips I can do to keep my mouth healthy? So you want to make sure you're brushing for 2 minutes twice a day, using an electric toothbrush. That's very important. Electric toothbrushes remove a lot more plaque than a manual. You want to make sure you floss once a day. It's a tough habit to get into, but it's very important. You want to make sure you see your dentist at least twice a year, and if they recommend coming more often, you want to follow through with that. So if you're due for your dental cleaning, give us a call. No matter how long it's been, we want to see you. And also, if you have any questions, feel free to send us an email or let us know on our Facebook page. Thank you.